prevent the flood of opioids into our state. Number one, they must stop shipment of suspicious orders. And number two, they must notify law enforcement when they do so. For years, these companies illegally shipped suspicious orders into our state. For years, they ignored their legal obligation to alert law enforcement of enormous, suspicious opioid orders. Their conduct, put quite simply, fueled the state's opioid epidemic by shipping staggering amounts of opioids into our state. Today I'm joined by a large number of folks. I'll introduce just a handful, including our speakers, but appreciate everybody who's here, including the extensive legal team and members of the public who are here. My legal team includes a few folks I'll introduce who've been working very hard on this case. Our Complex Litigation Division Chief, Jeff Rupert, also Senior Counsel Peter Helmberger, Assistant Attorney General Martha Rodriguez-Lopez, Assistant Attorney General Andrew Hughes, and Assistant Attorney General Tad Robinson O'Neill. These folks have put in long hours in addition to many other folks on the team on this case, as well as our earlier litigation against Purdue Pharmaceutical. Today you'll hear from Quinault Nation President Vaughn Sharp. The Quinaults have also joined a lawsuit against opioid distributors and have played a key role in trying to bring accountability to what is frankly outrageous conduct. You'll also hear from University of Washington researcher and L9 medical director Dr. Gary Franklin, who has published more than 15 peer-reviewed papers on the opioid issue, including reporting some of the first deaths. You'll also hear from two mothers who are very personally impacted by the opioid epidemic, Tammy Waranka from Kirkland and Shani Jenkins from Olympia. Also joining us today is Rose Dennis. Some of you may recall Rose from a press conference we had some time ago now when we filed our lawsuit against Purdue Pharmaceutical. Rose and her family have been very impacted by the opioid epidemic, and we appreciate Rose being here again in support of this action as well. Just as a background before I get into the details of the litigation, some of the information that we have has been legally designated as confidential, so there are some limits to certain information that we have with this litigation, and we just have to be mindful of that. That is sometimes the case in lawsuits of this nature, but we're going to share the information that we are able to share, which is significant. Our team has reviewed thousands of pages of evidence and shipment data. We've seen the data, and it is shocking. The opioid epidemic has devastated Washington state families and wreaked havoc on our health system, all because these pills were flooded into the state in astonishing numbers. So let me be clear, these three companies had a legal obligation to be a key line of defense against the free flow of opioids into our state. Instead, they were driven by greed. If you ever wonder how an opioid distributor becomes a Fortune 15 company, you ship 2 billion opioids to one state alone, and you ship those pills no matter what. You turn a blind eye to your legal obligations and the human tragedy that results. They had a legal duty to report suspicious orders to the DEA. They were legally obligated not only to report them, but to stop those shipments as well. They did neither. How many pill mills might have been shut down if these distributors had simply followed their legal obligations? How many lives could that have saved? Today I'll outline how the actions of these three distributors fueled the state's opioid epidemic by ignoring these legal obligations to act as a safeguard. We'll also talk about what we hope to achieve from this litigation. We'll have other speakers as well, and then we'll take your questions. So these three companies supply the majority of opioids coming into Washington state. Between 2006 and 2014, during that time period alone, they supplied more than 2 billion opioid pills to Washington. As I mentioned, opioid distributors are legally required to monitor opioid orders they receive, looking for specific factors that can identify suspicious shipments that could be diverted into the illegal drug market. So for example, if a pharmacy suddenly triples its order quantity, that's a red flag. Or if a pharmacy that typically orders once a month suddenly places an order once a week, that's a red flag. If they determine that the order is suspicious, distributors are legally required to stop the shipment and report the suspicious order to the Federal Drug Enforcement Agency. And I believe we have a chart that once we wrap up, you'll be able to see behind our many folks who are here that outlines those obligations. These companies fail to fulfill that obligation. In fact, even when their internal monitoring flags suspicious orders, the companies often ship them anyway without notifying the DEA. The DEA tracks every shipment of opioids. Much of that data is part of the confidential information that I mentioned earlier, but I can give you a general sense of the scale that we're talking about. So let me give you a couple of examples. In 2014, these 3 companies shipped enough opioids to Pend Oreille County to supply every single man, woman, and child in that county alone with dozens of pills. In 2009, McKesson alone supplied enough opioids to Pend Oreille County to supply every man, woman, and child with dozens of pills. These companies will say they had compliance programs, but if they did, they were compliance programs in name only. Using a very conservative calculation developed in a court case in the Washington, D.C. Circuit to identify suspicious orders, these companies shipped more than 250,000 suspicious orders to Washington between 2006 and 2014. Using a less conservative calculation developed in one of the other court cases against opioid distributors, these 3 companies may have shipped more than 3.5 times that many suspicious orders into Washington state, totaling nearly 1 million suspicious orders that should never have been shipped. To put this in context, a typical order contains hundreds of pills. These 3 companies have been sanctioned repeatedly for not monitoring and reporting suspicious orders. For example, McKesson has paid more than $160 million in fines since 2008, including a record-setting $150 million fine in 2017. The DEA determined the company filled, quote, hundreds of suspicious orders placed by pharmacies participating in illicit internet schemes, but failed to report the orders to the DEA. Cardinal Health has been fined 5 times for a total of nearly $100 million since 2008, including a $34 million fine for what the DEA called, quote, failing to report blatantly suspicious orders. The DEA suspended AmerisourceBergen's license in 2007 over not controlling shipments of prescription opioids to internet pharmacies. The DEA noted that between June 2008 and May 2013, one McKesson distribution facility, quote, processed more than 1.6 million orders for controlled substances, but reported just 16 as suspicious. These distributors had a legal obligation to stop suspicious orders and report them. Because they did not, more opioids flowed into Washington state. That led to, inevitably, more opioid prescriptions filled, more of these dangerous pills find their way into the illegal drug trade, more addiction, and more devastation. I do not have to tell you how crushing the opioid epidemic has been to Washington state and to our country. All you have to do is look at the statistics. Between 2006 and 2017, opioid overdoses killed more than 8,000 Washingtonians. On average, 2 Washingtonians die every day due to an opioid overdose. That's more Washingtons than were killed by car accidents or gun violence by firearms. The sheer volume of pills flooding the market is a key contributor to that devastation. In 2015, there were 8 counties with more prescriptions than people. So I want to be clear, that's prescriptions, not pills. There were more prescriptions than people. Clallam, Grays Harbor, Columbia, Garfield, Asoden, Pend Oreille, Lewis, and Benton. We have a chart you'll be able to see after we're done that outlines those counties. In 2008, there were 16 counties with more prescriptions than people. It is time to hold these companies accountable for the harm that they have caused. What we'll be seeking is the following. We allege that these 3 companies committed multiple violations of the Washington State Consumer Protection Act. As you know, the State Consumer Protection Act outlaws unfair business practices, and that'll be part of our litigation. We also allege that these companies helped create what's called a public nuisance, that's a legal term, public nuisance of the opioid epidemic through their negligent action. What does a public nuisance mean? In this case, the conduct of these companies has fueled a public health crisis, forcing the state and communities across the state to spend massive resources to try to address this crisis. In addition to civil penalties and damages, we're asking the court to order these 3 companies to give up the profits they made in Washington as a result of their illegal conduct. Sales of opioids are worth billions of dollars every year nationwide, and Washington's portion is expected to be in the many millions. The surrendered profits will be used to remediate the effects of the opioid epidemic, possibly funding treatment, education, and more. That's the goal. So at this point, I'd like to turn to our speakers. First up is Quinault Nation President Fawn Sharp, who's been a key ally on many, many fronts, and this one is no exception. So President Sharp, thank you very much.
Thank you. Thank you. On behalf of the Quinault Indian Nation, first of all, I want to thank the Attorney General for his bold and aggressive action with filing this lawsuit. I also want to thank the colleagues and the team that stand here with us, the families that have suffered. The Quinault Nation, unlike any other tribal nation across this country, is facing a humanitarian crisis. This last December, the U.S. Commission on Civil Rights delivered a report to Congress that outlined in detail the devastating impacts of alcohol and drug addiction to Indian country. One of the alarming statistics in that report was that tribal nations, our citizens, need treatment at a rate that's twice the national average. 18% of our citizenry is in need of alcohol and drug treatment. We suffer the consequences of alcohol and drug addiction higher than any other citizenry across this country. But I want to make it clear, while we suffer at an alarming and astonishing rates, not one citizen in the state of Washington is immune from this crisis. Every single family is deeply impacted by this crisis. Our healthcare system, our economy, and outright loss of life and loss of futures and productivity. And so when we come together with the state of Washington, tribal nations, we have a history of conflicts and controversies. But at those times when we come together and we stand on bold, aggressive action, there's no question in my mind that we are going to see results, because this crisis takes everyone. We are all impacted, and it's going to take all of us. Now, every day we deal with the symptoms of a crisis. We try desperately to seek out funding to provide treatment. We desperately attend funeral after funeral after funeral, and there are times we feel helpless. We wonder if there are any solutions. But those things that we deal with are symptoms of a much deeper problem. And that deeper problem is that there are companies, there are criminals that seek to profit at our expense at the lives of young people, middle-aged people, and elderly people of every socioeconomic sector that exists in the state of Washington. But while we feel helpless, we know there's a path forward to seek justice. And that path forward is to hold those who are directly responsible accountable. And so today we stand here honorably, we stand here in full force, and we are not going to give up. We are going to continue to seek the justice and bring those who are directly responsible to justice. So together we are here, and I thank you from the bottom of our hearts, those Quinaults that have existed on these sacred lands when time began, and those future Quinaults that will join us, and those future generations of Washington citizens, because we all deserve to have a very bright future, a prosperous future, and a healthy future. And this lawsuit is going to be but another example of bold and aggressive leadership from our champion of justice, Attorney General Bob Ferguson. I thank you for this opportunity, and we stand here with you 110%. Thank you.
Thank you very much, President Sharp. Next, you'll hear from Dr. Gary Franklin. Dr. Franklin.
Thank you, Attorney General Ferguson, and thank you for your leadership. I reported the first deaths in the country. Jamie Mai, my pharmacy manager, and I were tracking things. 1999 was when our state regulations became more permissive, and the increasingly permissive regulations occurred in more than 20 states because of fake lobbying by drug companies and their surrogates. We reported these first deaths in 2005, but all of the increased supply of opioids started in 1999 when these regulations passed. Our regulations, which have since been repealed, said that no doctor shall be sanctioned for any amount of opioid written. You could be handing out bags of opioids to patients, and the medical board really couldn't do anything about it. So after we reported the first deaths, these were injured workers who came into our system with a low backache or a shoulder ache, and they died within a few years from prescription opioids. Not one citizen should be dying from a prescription opioid in our state or anywhere in the country. So we became very collaborative at that point, and with the blessing of the legislature and the successive governors, the agency medical directors group, including the Departments of Health, the Department of Labor and Industries, the Medicaid, Healthcare Authority, all of the agencies started working with the highest level clinicians in the state, pain specialists and other specialists, to create the first best practice treatment guidelines related to opioids in 2007, in 2010, and in 2015. And the impact of all of these best practice efforts has been to lead to almost a 60% reduction in the deaths related specifically to prescription opioids. But we have only dug out of this problem by about 40% because of the continued unbelievable supply. Over 200,000 Americans have died from this worst of man-made epidemics in our country, made by doctors and drug companies and distributing companies. So I want to thank the Attorney General for this effort. We believe that there is a path forward to reverse this epidemic, and I just want to quickly mention the three main things that we're doing to reverse the epidemic. Number one is to reduce the amount of opioids going to people for acute pain, such as teenagers who are having a tooth extracted. 20 pills for a 17-year-old who's having a tooth extraction. That is a recipe for disaster subsequently. The second thing is we need to, as agencies, we need to get best practices out in the community for primary care doctors so we can take better care of patients in pain and in chronic pain. And we're doing that also. And the third thing, and this is probably the most difficult thing, is that we need to address the tens of thousands of our citizens who are already on chronic opioids and who are dependent or addicted to opioids. We need to get them the help they need. So we have to have a prevention effort and a treatment effort to be much more collaborative to reverse this worst of man-made epidemics. Thank you very much.
Thank you very much, Dr. Franklin. Now we're going to hear from two individuals who are going to speak from a very personal perspective. I've talked, for example, with statistics, and the statistics have a important place to set some context for the scale of the epidemic, for example, that we're facing now. But our next two speakers are mothers who will speak about their personal experience with this epidemic, and I introduced them earlier. But first up, we'll hear from Tammy Waranka. Tammy, thank you for being here, and we look forward to your comments.
Thank you very much. My name is Tammy Waranka, and I'm really thankful to be here today, and it was really something that I got asked to be here and speak, and so sorry about that. I'm sharing my son's story. His name was Seth. He was 30 years old, and on December 31st of 2017, he died of an accidental overdose. He was on methadone. I believe he had overdosed on heroin. He'd also been on Xanax. And so the combination was lethal. And I ended up finding him on a Sunday morning when I tried calling him to go to church with me and couldn't get a hold of him. And I had his landlord go in and knock at the door and see if he was okay. And I was really worried because I called him that morning and I couldn't get a hold of him. And so she finally said, I give you permission, go ahead and go on in and just see if he's okay. So she went in, and he was already dead at that time. And I think he had probably passed away earlier that morning. And I ended up running up there very quickly and just hysterical, not really believing what I was hearing. And it just kind of went from there. So it's been a really tough year for me. I lost my mom 2 months before that. And so 2 deaths in the family was just almost too much for me to bear at the time. I would like to share Seth's story. He was addicted to opiates also, but his story is probably a little bit different than the heroin story and the illegal prescriptions that you get in pills. His was going to a methadone clinic, and his drug of choice was methadone. and that is basically synthetic heroin. And if anybody knows anything about that, I've done a little bit of research on it. It was actually discovered by Hitler during World War II, and ended up giving it to the troops when they ran out of morphine, and they made synthetic heroin and gave it to the troops, and that's how it ended up getting started. I'll go ahead and share you just his story. Seth started doing drugs at 13 years old, doing marijuana with some friends. I didn't even know he and his brother were doing so. I was working full time. I was very naive and had never been around drugs at all. I had grown up on a farm in Idaho, and I never grew up in my town where anybody really did a lot of drugs. I came from a very tiny town. And one day I came home and I smelled a funny smell, which kind of smelled like sagebrush to me. I grew up on a farm with a lot of that, and this is where I also started getting my introduction into drugs. At 16 years old, Seth started getting pills from friends, and his drug of choice was methadone pills. Before long, he was getting so dependent that he needed every day in order to make it through the day. At 17 years old, he talked to his grandfather and talked him into starting at a methadone clinic. Not knowing at the time much of anything about it, but hearing that it could help him, he signed up in 2003 to 2004, and he started going 6 days a week to methadone clinics. After a few years, Seth tried to get off, and he started experiencing withdrawals early every morning until he could go to a clinic to get his dose. After experiencing the pain and mental anguish of withdrawal, he decided to try detoxing, but it was so hard for him to break through and get off. At this time, the changes affected his way of life and his choices with others, family, and living. The drug ran his life at every turn and was the first thing he thought of when he got up in the morning and the last thing he thought of when he went to bed. After that, especially if he could make it to the methadone clinic. He always worried about making it to the methadone clinic early in the morning to dose because he always closed at 10:30. And so if you were on your feet walking, or if you had to take a bus, which in his situation usually he had to take a bus, it didn't always get there at 10:30 or by the time he needed to be there. And so sometimes that would be extremely painful because afterwards they didn't give you your dose after that. It was closed, so you had to wait till the next day and go through a 24-hour period before you could ever go and dose again, which is excruciatingly painful. As Seth started being dramatically affected by methadone, he ended up making some bad choices. He would get kicked out of places he lived and eventually ended up on the street for several years. We tried to help on every way we could, but had to let him live his life, praying and hoping that he could get help. On the streets, he was tempted to do other drugs, from opiates to meth. We tried to help him with detox treatment and usually to no avail. First of all, because detox places weren't long enough to give your body a chance to detox off methadone. By this time, Seth was also taking benzodiazepines for anxiety and panic attacks. That in itself was so addictive, and detox places made you detox off anything you were on, even if it was medical and you needed it for anxiety. By this time, after the last 10 years on methadone and hospitalizations in detox, his body started to break down. With at least 50 hospitalizations over a 30-year period, he realized it was almost easier just staying on methadone and either dosing down very, very slowly over a short period of time or staying on it for lifetime maintenance. His health declined, and he ended up needing all his teeth pulled due to negligence of being on the streets. He even had prescription for pain after his teeth were pulled. He got a prescription for pain after his teeth were pulled, but as we were going to the methadone clinic, he had accidentally left his lockbox on top of the car. Not realizing that he did that, we turned around and went back, and it was stolen during that period of about 20 or 30 minutes. After explaining to the doctor, they would not refill even with the pain he experienced, and no doctor will usually reply or refill something like that for an addict. About 5.5 years ago, Seth's life started turning around when he had a salvation experience and he gave his life to Jesus Christ. I'd never seen him happier, and it changed him from the inside out and gave him peace of mind and a hope in getting through the trials of life. Anyway, that's all I've written there, but after that time, Seth started doing a little bit better, and he started actually wanting to get off methadone. And so he would go to probably about 5 different clinics over a 13-year period, all the way from Everett, all the way down to South Seattle at Evergreen. And when he went there, a lot of times he'd say, I want to get off this stuff because it is ruining my life. I have no life. He ended up having 2 children, ended up having to adopt them out because he was not able to take care of them. He didn't have the health and the energy, and the addiction was so bad that he couldn't do that. So they were adopted out. He ended up losing all his teeth. He lost his health, many, many hospitalizations. And during that period of time, we tried to help him get off methadone many times. But the problem is with methadone clinics, you go in and you tell them you want to detox off methadone. They usually say, well, that's okay, but why don't you go up on the dose? And he'd say, I don't want to go up on the dose. I'm already at where I want to be. I want to get off. That's the whole goal of getting off this stuff. And they would try to encourage him to up the dose all the time. And so they'd make it really hard for him. And so they'd say, okay, we're going to detox you, and we're going to give you 5 milligrams a day and detox you in 21 days. And so in 21 days, when you're on methadone, it lives in your bones, it lives in your tissues, it lives in every part of your body, and it's not something easy that you can get off of. And we took him to Harborview Hospital, and when we got there, the doctor said, you know, Seth, you've been on this for over 5 years. And anytime you've been on methadone for over 5 years, you're what we call a lifer, which means that you're probably not going to get off this stuff. You know, it's almost virtually impossible to get off this stuff. And so he didn't know what to do. And so he was caught in a catch-22 of not knowing what to do. And she said, you can go ahead and try to detox, but more than likely you're going to end up going back to the methadone clinic because it's going to be too painful for you. So he went to many detox centers. He went to many different treatment centers. The problem with the detox centers, and this is where I believe the problem is a lot, not only with the responsibility, also with the addict and their choices. They all make choices, and sometimes they get themselves stuck in a situation where they went too far, life got hard, and actually it wasn't fun doing drugs anymore because actually it got you addicted. It changed your brain chemistry. It changes the way you do things. It changes the way you think. And anyway, so he ended up going to Harborview, and he ended up going to detox. But the problem I'm seeing with the detox is that they will only give you a short period of time to detox, usually 3 to 5 to 7 days. That is all the time you can detox on methadone. Well, methadone lives in your system, so when you get out of detox, what do you do then? Okay, you still have it going on in your body. You're sick, you're vomiting, you're throwing up, you can't sleep at night, you're up a week at a time, you can hardly function, hardly get on the bus to get to that clinic the next day. And so it didn't work for him, and he got kicked out of probably every detox facility he probably ever went in because he got too angry because he kept telling them, you know, you give me the withdrawal meds and everything to help me, but those withdrawal meds are addictive in themselves. And so they would give him those meds, but his tolerance level was way up here. And with all the drugs over the years, a little bit that they could legally give him just didn't cut it to get through the pain. And so he ended up leaving. He would go back to the street, and he would buy it on the street. Before he passed away in 2017, he said, Mom, you know, if I could do anything and tell anybody anything, it would be please, please don't go on methadone. And it's not that methadone can't help you. They usually give that to heroin users so they don't use needles, and they can go to a legal clinic and they can take a little pink vial of juice, pink juice, that they give you 6 days a week. You take home a carry case on Sunday. And it can help you short term. It can help you maybe get off the needles and help you get your life back. A lot of people that are on methadone can work a job, they can function, they can have family, and some people do okay. But there's some people that don't. And so he said, Mom, if anything at all, I would warn people if they're going into a methadone clinic, I want to tell them so bad, please don't go. It will ruin your life. It's so much harder than heroin to get off of. It isn't even funny. And I would tell them, don't do it. It's easier coming off the heroin, going through the withdrawal, doing what you need to do than getting on the methadone, which is going to be 10 times worse than the heroin. And so, anyway, he just said he would warn people. And the last thing he said before he passed was, he said, Mom, if I ever get a chance to and I get through this, I would really love to go over after those pharmaceutical companies that distribute this stuff. Because he said, when I signed up for methadone when I was 17 years old, and my dad and I helped get him on it, but we didn't know what it was, and we didn't have any idea what we were getting into. They do not tell you that it is more addictive than heroin. They don't tell you that it will destroy your life, and they won't tell you any of this. And they paid $350 a month back in 2004, 2005 to go to a methadone clinic. Finally, over the years, he got on SSI. He was having a hard time. He got on disability, and he was able to get medical coupons, which helped him be able to pay for the methadone. But it's a very expensive drug. They know what they're doing, and they know it keeps people addicted, and it's a billions of dollar industry a year. And they're not going to tell you that it's dangerous and don't take it. And so that's my take on it, and I hope today, I just thank you for the opportunity to bring awareness. That is my son's story. That is a personal methadone story, and I know it affects a lot of people out there on methadone, and they're in a lot of pain and a lot of hurting. And so thank you for the opportunity. I really appreciate that.
Thanks so much, Tammy, for that. And next, we're going to hear from Shani Jenkins, who will tell her story, and then we'll take questions. So,